you know, because it's been on every news site, he is in self-quarantine. Senator, how are you doing?
Michael, I'm doing terrific. I am feeling fine and healthy, and I'm glad to be with you.
Walk us through, if you would, your decision to do this. I know you didn't do it lightly.
Sure. So it was Saturday evening. I was at home, was getting ready to head out, and I got a phone call that 9 days earlier at CPAC, there had been an individual there who has gotten sick and has tested positive for coronavirus. And they asked him with whom he'd been in contact. And he listed one senator, he listed me, and several other members of Congress have since come out as well. So they called me Saturday night and said, well, this individual who's sick and has tested positive for coronavirus was in contact with you. And I recalled seeing him and saying hello, and I shook his hand. I probably had an interaction of about a minute with him. And so when I got this call, I promptly reached out and talked to CDC and talked to HHS, and I talked to both the City of Houston Health Department and the Harris County Health Department. And the doctors, all of them, gave me the following advice. They said, given how brief the interaction was, that it was less than a minute, and given that it had been 9 days since I had the contact and I had no symptoms, I'm not sick, no fever, no cough, no nothing, they said the odds were very, very low that the virus was transmitted. Typically, the incubation period, they said, is between 5 and 6 days. If you're going to get it, you usually get sick in about 5 or 6 days. So they told me, they said, look, you don't meet the CDC criteria for voluntary quarantine, self-quarantine. But they said, you can certainly still do so if you want to. And as I thought about it, given the nature of the job I have representing the state of Texas, there are 28 million people in this state. I am, as you know, I'm out talking to people all the time. I just decided it was prudent. It was out of an abundance of caution. It was the right thing to do because I knew that I had been in contact with someone who was positive with the virus, to self-quarantine for 14 days from the date of the contact. And so I stayed home Saturday night and have been at the house since then, just waiting out the quarantine.
You know that everything you do is going to be remarked upon. It's going to be reported upon. What do you hope people take from what you've done?
Well, I hope people treat this outbreak seriously. I mean, there are some extremes out in the among the chattering heads on cable news. On the one side, there are a lot of folks in the media that are trying to trying to describe this as the apocalypse, like the end of the earth, everyone's going to die. And I think they're needlessly stoking panic and hysteria. I think that's a mistake. But it's also a mistake to say this thing is it's not real and it's not a threat. That is not accurate. This is a serious epidemic. There are over 116,000 confirmed cases worldwide. There are over 4,000 people who have died, and it is quite contagious, and it has a significant fatality rate. Now, the fatalities seem to be confined primarily to older people with significant health vulnerabilities. And so what I would advise everyone, take this seriously, and that means listen to the CDC, listen to the health professionals. For seniors, the advice of the health professionals is if you can, stay home. So, Michael, for example, my parents, my mom is 85, my dad is 81. I've advised both of them, just stay home. You don't need to go out. You don't need to, they're certainly not out hitting the discos, but, just I told my mom, stay in your apartment. Even before I got the information that I had been in contact with someone who had tested positive, I had told my mother I wasn't going to come by and see her this weekend just because I'm out enough that she's 85, she's a 2-time cancer survivor, and I just didn't want to run any risk with her. And I think that is prudent. I think for the people listening, practicing good habits, things like washing your hands frequently with soap. They say soap and water is more effective than hand sanitizer for this particular virus. Things like if you're sick, if you wake up and you're coughing and you've got a fever, don't go into work. I think there are common sense steps we can take, but this virus is real and it's spreading, and I think there are going to be significantly more consequences before it runs its course.
So obviously Heidi and the kids are there. We can hear them in the background, which is kind of cool. What is your thought?
Caroline just played some sort of prank on Catherine. So I've got a jubilant 11-year-old and a very unhappy 9-year-old, and I'm not sure what the prank was.
You're getting some quality family time that maybe you needed to be forced into. Maybe this is God's way of saying take a little more family time.
Well, and I'm deliberately at home. I'm keeping a minimum of 6 feet between me and the family, and that the doctors advised, I mean, in fact, they advised that they could go on and just go on their lives, go to work, go to school, and they've decided to just stay home for the same period, just because people are really nervous. They're freaked out right now, and I get it. I understand why people are nervous, but my advice is treat it seriously and listen to the health professionals. And we have had health crises before, and we'll get through them, but we get through them by listening to the doctors and by applying common sense steps to prevent the spread of disease.
So what about the idea of, I know we don't want to reveal someone's identity because we don't want them to be outcast, but how do we tell folks, if you know that person, you need to be checked?
So one of the reasons I put it out publicly is because I'm now 12 days into the quarantine, but in the 9 days before I got the information, I've interacted with hundreds of people. I mean, that's just the nature of this job. Now, I asked the health professionals, I said, okay, what do people need to be concerned? Does anyone need to do anything? And they said the risks of transmission in those circumstances were extremely low. And they said because my contact was so limited, but B, because I'm asymptomatic. I don't have any symptoms. I'm not sick. And they said the time when people transmit the disease is when they're sick. And so the fact that you're not sick means that anyone who's encountered you does not have reason to be concerned any more than you have reason to be concerned because you went to the mall a week ago. And
right. Senator, hold on just a moment. Hold on just a moment. We're talking with Senator Ted Cruz. He has self-quarantined due to exposure to an individual who has tested positive for the coronavirus. As a policymaker, Mitch McConnell has addressed you self-quarantining, from the floor of the Senate. How do you foresee this thing playing out?
Well, I think there are a number of steps we need to focus on. The outbreak, as you know, occurred initially in the Wuhan region of China, and it spread rapidly there. One of the unfortunate reasons it spread so rapidly is because the Chinese government tried to keep it quiet, tried to hush it up, didn't marshal the resources to try to contain it until it was too late. And even now, the statistics we have just over 80,000 confirmed cases out of China. We have just over 3,000 confirmed deaths. But that's based on the numbers from the Communist government of China. And when we know that they lie, and they lie frequently. So it is possible the numbers are not just worse, but much, much worse than that. One of the most important public policy decisions that has been made since this outbreak began was the decision the president made to halt commercial air travel to and from China. That was done early. That was done very shortly after news that the outbreak occurred. And it was controversial. It was risky. I talked to the president, I think 2 days after we had halted commercial air travel, and he'd also imposed a quarantine on Americans coming back from China. And he asked me, he said, Ted, what do you think? And I said, look, Mr. President, I think you did exactly the right thing. There are real economic repercussions. That's a significant step to halt commercial air travel. But given the threat to human lives and safety, I think that has to be our first priority. Last week, I chaired a hearing on the Senate on the coronavirus and had experts from CDC and from Department of Transportation and Customs and Border Patrol. All three of the expert witnesses testified that the president's halting air travel had a major effect slowing down spread of the virus, and that if we had not halted air travel, we would have many more cases of the virus in the U.S. and in all likelihood, many more fatalities. So that was an important first step. We need to be continuing to work in terms of finding people with a virus, quarantining them to prevent its spread. We need to be engaged in research for vaccines and treatment protocols, and we need to be, among other things, making sure we secure our border so we're not allowing more spread of the virus into the country.
It sounds like you are very supportive of what the Trump administration has done. Is there anything that has not yet been done that you would like to see done with regard to this?
Sure, and listen, there were undoubtedly challenges in the rollout. I mean, dealing with a public health crisis, there's a phrase, the fog of war, and that's true with any crisis. So with respect to one of the people who was quarantined at Lackland Air Force Base in San Antonio, that individual tested negative. They released him into the community of San Antonio, and then there was another test that had been done that tested positive. They brought that individual back. That was a significant mistake, and they changed their protocols in terms of when they release people from quarantines based on that. But that was a serious mistake on behalf of CDC. That was one of the things I pressed them on at the hearing we had last week. Additionally, the government was not as swift as it should have been in rolling out tests and getting them across the country. And so it was, particularly 2 weeks ago, it was slow and difficult to get tests. Substantially more tests have been made available. And I'll tell you, in my circumstances, some people have asked, well, have I been tested? I haven't. And I asked all the doctors. I'm more than happy to be tested. But I asked all the doctors, and all of the health professionals told me it was not effective or useful to be tested if you're asymptomatic. If you're not sick, the test doesn't work. That the only time you have a sufficient concentration of the virus for the test to work is if you are experiencing symptoms. And so that limits. So that means if you're just sitting there at home nervous.
Senator, what have you learned? Obviously, because you were exposed to coronavirus, I know you have known you for over 20 years. You've probably studied this thing more than anybody in America. What have you learned that's made you feel better or more concerned about its spread as a result of your exposure to this?
Well, it's a great question, and let me say to all your listeners, let me encourage you to go listen to Michael's podcast, but I actually this afternoon in my living room filmed another episode of my podcast as well.
That's a rival podcast. It's number one on all of iTunes. Go ahead. Let me give you your due. You're good at it.
It's called Verdict with Ted Cruz. As Michael referenced, it shot to number one, the number one ranked podcast in the world during the impeachment trial. And so listen to Michael's podcast, but go sign up. And we just did a whole podcast on coronavirus and
do you realize
and what's going on.
That if I could get the hits that you're getting, the listens that you're getting with you and Michael Knowles with that podcast, if I could get those number of podcast listens for my podcast, my bonus would be so big that you and I could share that and we could buy a private jet. I mean, you guys are killing it. You're killing it. But anyway, go ahead.
We had 4.5 million downloads in just a couple of weeks. And look, the nice thing about it is, and this is what you're doing every day on air, is it's getting substance to people who are interested in it. And it's facts and going in depth, but also having fun and cutting up at the same time. And so people have, and by the way, one of the things that is very helpful, like when every time I go on your show and talk about the podcast, a whole bunch of people go and sign up for Verdict with Ted Cruz, and they go whether to Apple Podcast or YouTube, they subscribe to the channel. And
well, I want you to know that I listen to the podcast, and I want to tell you that Nigel Farage was very good, but your Thea Sonia interview, it had me practically in tears. I mean, it was so powerful, talking about immigration from Cuba, talking about communism, talking about what all that means. It was, I was truly, you missed your calling. I mean, politics is number two. You should have been a talk show host. It was really powerful, I got to tell you.
Well, that is high praise. That's my favorite podcast as well, as the one with my Thea Sonia.
Wow.
It was when Bernie had been praising praising Fidel Castro, and it just pissed me off. And so I called my aunt and said, "Hey, can you fly to D.C. tomorrow and let's film a podcast?" And she went and got on a plane. You know, interestingly enough, if that had happened 2 weeks later, I wouldn't have done that podcast because my aunt is old enough that I wouldn't have wanted her to get on a plane.
Sure.
And so we actually talked about that. We filmed that podcast in D.C. on Wednesday, week before last. It was the day before CPAC where I encountered the fellow who's tested positive.
Right. Well, you are a man of faith. I've known you for over 20 years, and I know that is a deep part of who you are. You're the son of a preacher. You're the son of a Cuban immigrant. Nothing happens without a purpose, and you know as well as I do that all of that lined up just right. Where are we with coronavirus? Where are we going to be? We talked a little about this during the break, and that'll be on the podcast, a separate podcast, our conversation then. But I mean, is this 3 months? Are we 6 months? How far are we from getting back to a normalcy?
So unfortunately, the short answer is we don't know. I mean, I have asked that question to CDC repeatedly. We're still learning about this virus. If you look at after China, you look at the countries where it's spread. Italy right now is on almost total lockdown. They've canceled every sporting event. They've canceled public gatherings. They're not having people coming in and out. I mean that, but Italy is spreading and spreading rapidly here. That could happen here. I mean, it is entirely possible. We've already seen major events canceled, things like South by Southwest here in Texas. Certainly events that involve people traveling internationally, those are likely to be canceled. I just got the news of this afternoon, my 25th law school reunion that Heidi and I were going to go up and go to has been canceled because of this. That any large gathering where people are coming together, this health outbreak is likely to impact you in that regard, and it could impact travel. It certainly impacts international travel. But we need to be last week, Congress voted out $8.3 billion in emergency relief. I think we need to focus what we do specifically on stopping the spread of the virus, on working to develop a vaccine. You know, we talked about being tested and that we don't have a good test right now for when you're asymptomatic. It would be really good to develop a test that someone could take to determine if they'd encountered the virus before they got sick. We don't have that right now. One of the things that I've been pushing in the Senate is legislation called the Results Act that would streamline the FDA approval process so that if a pharmaceutical or a medical device is approved in another major developed country like Europe, like Canada, that the FDA has 30 days to approve it here. We should at a minimum do that for coronavirus-related either vaccines or treatments to expedite the medical research and devoting the resources to stopping this outbreak. But as with other health crises, this is an epidemic, and it is going to take some time to contain it.
Well, is there anything else we're going to need to do to deal with this? I got about a minute left that you would like to see done so that we can ride this thing out and put it behind us?
So one of the things I've been working with Governor Greg Abbott and working with state and local officials is to make sure we get protective gear to our first responders. If we see a similar escalation like Italy has seen, like China has seen, that means our first responders are going to be in harm's way, and we need to make sure to get protective gear. We also need to look at particularly the supply chain with medicines that go through China. We've got a real vulnerability in terms of our exposure to China. That's a long-term policy issue that I've been leading the fight on, but all of us need to get much, much more serious about.
Well, let's hope we do. And Godspeed, you making sure you get back to the United States Senate very soon. As America's senator, the entire country is rooting for you to get back soon. But in the meantime, your girls can play pranks on each other, and we can hear them in the background, and that's a beautiful thing, brother. Thank you, Senator Ted Cruz.
God bless.